Have you ever wondered if certain lifelong experiences or ways of interacting might point to something more? Many adults recognize patterns in their lives that resonate with descriptions of autism, and understanding the official criteria can offer incredible clarity. The core traits of adult autism, as defined by the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, commonly known as the DSM-5, fall into two main categories. These criteria are the gold standard used by clinicians to diagnose autism spectrum disorder in individuals of all ages, including adults. The first primary area involves persistent deficits in social communication and social interaction across multiple contexts. This means an individual might experience difficulties with back-and-forth conversation, struggle with nonverbal communication like eye contact and gestures, or find it challenging to develop and maintain relationships, often lacking an understanding of social cues. The second core area is restricted, repetitive patterns of behavior, interests, or activities. This can manifest as repetitive movements, an insistence on routines and resistance to change, highly restricted and intense interests, or unusual reactions to sensory input, such as being overly sensitive to certain sounds or textures. It is important to note that for a diagnosis, these traits must have been present in the early developmental period, even if they were not fully recognized until later in life, and they must cause clinically significant impairment in social, occupational, or other important areas of current functioning. For adults seeking a diagnosis, these DSM-5 criteria serve as a comprehensive guide for clinicians, not just a simple checklist. A thorough evaluation involves in-depth interviews, often including discussions about developmental history from childhood, and careful observation of current behaviors. This detailed process helps professionals understand how these traits have impacted an individual's life over time, ensuring an accurate and thoughtful assessment. One particularly relevant concept for adults is called camouflaging or masking, where individuals learn to hide or suppress their autistic traits to fit into neurotypical social expectations. This can make the diagnostic process more complex, as these learned behaviors might obscure the underlying criteria, but experienced professionals are trained to look beyond these coping mechanisms. Recognizing this can be a key piece of insight during evaluation. Understanding these core DSM-5 traits provides a valuable framework for adults who suspect they might be autistic, or for their loved ones. It is not just about identifying challenges, but about gaining self-understanding, finding a community, and accessing appropriate support and resources that can genuinely enhance well-being and daily life.